Moving now to Cancun in Mexico, I would like to invite Paulina Alcazar from Cadena News to ask the next question.
Good day to everyone from Cancun. What considerations should be taken into account with a high number of reinfections, or is it considered as a long COVID, a persistent COVID, when someone is positive again at a test several months later? What do we consider it as?
So thanks for the question. There's two aspects to the question that you've asked. One is about reinfection, and then I think the other one is about long COVID. So these are two separate things, and let me just break them down very briefly. So we do know that there are some individuals who can be reinfected with this virus, and this is being detected in a number of countries that have good lab systems that have been able to do a sequence of the first infection and a sequence of the subsequent infection, the second infection, and they can tell that there's a difference in that virus, a slight difference because the virus changes, and that is indeed a subsequent infection. This is now starting to be picked up in a number of countries. The question around long COVID is that there are individuals who have been infected with the SARS-CoV-2 virus. They have an acute disease where they're very unwell or they're mildly unwell, and then they seem to slightly recover, but they're having longer term effects. We are learning more and more about what long COVID is in terms of the effect on the body. It seems to affect many different organ systems. It's not just a respiratory illness of 2 weeks. It seems to persist for months. We have met, and the Director General has met with patient groups, and the patient groups have said to us what they need is recognition that this is real, and this is real. And there is now an ICD code for post-COVID syndrome, it's called. So we're working with clinicians to better design and work on rehabilitation for individuals who are suffering from this to ensure that we give them the best care possible. So we have a lot to learn in this area. There was a forum that was organized this week by ISARC and partners, which WHO participated in, and we have seminars and working groups that have been established specifically to look at this so that we can provide adequate care.
And if I could just emphasize what Maria has been saying, it is best that we all try to avoid this infection. It's better and not to have to be concerned about your health going forward. Also to reassure people, yes, the vast majority of people do have an infection that doesn't result in any ongoing specific effects, but there's a significant minority of people who are suffering very, very long into a post-COVID period. And our hearts go out to them as they approach this Christmas period, because and sometimes in life, mortality and death is recognized and we all sympathize. It's very hard when you're carrying the after effects of an illness. It can be a very lonely experience, and people don't want to attract attention to themselves because people may think I'm infected and I'm still coughing. So people are going through a lot of psychological trauma as well as having those lingering effects. So I think we should all be very kind to each other, and particularly kind to those who've had to fight through very difficult infections and have the continued concern of the long-term impacts on their family. And to our journalist, I would say, given the weather here today in Geneva, we would love to be with you in Cancun.